school system, there are a series of activities that are usually carried out and are directed towards achieving some set of goals. And those deliberate activities that are carried out and directed towards promoting health in the school system are our topic of discussion for today. School health program. School health program refer to the positive health activities that are carried out in a school system to promote teaching and learning. In other words, school health programs are health activities such as health knowledge, services and practices that are provided by the school for the well-being of the school children, teachers, and workers so that learning and teaching will be effective. What are the components of school health program? The school health program is divided into the following components, and they are health instruction, school health services, healthful school living, home school, and community services. We're going to take them one after the other. Health instruction. These are classroom activities. That is, it is the instructional period that is allotted to the teaching of health knowledge. Those contents that are discussed in the classroom about health are known as health instruction. Now, during the school period, the following contents are taught and covered. We have personal, school, and community health. We have food, nutrition, and health, pathogens, diseases, and their preventions. We have safety, education, and first aid. We have physical fitness and health consciousness. We have historical foundation of health education, and we equally have environmental health. And finally, we have health education issues and challenges. All these are the things discussed under health education in the school health program. School health services. This is when the school authority organize health activities to know the health condition of students and staff in the school. It is usually periodically, that is once in a while, the school organize a program to know the health condition of the students and the teachers in the school. Healthful school living or environment. This refers to a clean physical, social, emotional environment that is provided within and outside the classroom to create better learning conditions. There is home school community health services. In order to complete the health education program, the home, the school, and the community equally have to play their own cooperative roles. The students should know what to do at home when there is health problem or what to do to avoid health problem. Example, the current pandemic, COVID-19, how it has impacted us in the school, at home. So the home, the school, and the community all have to contribute in ensuring that our students are safe from the dangers of this pandemic. Fresh approach to school health program. What is the meaning of fresh? Fresh on its own is a word or an acronym. It is derived from school health program. Now, in other words, if you refer to it as an acronym and each letter stands for individual words, there is focusing resources on effective school health. This is a school health program that ensures that all children of school age they have access to basic and quality education. Now, in order to achieve this, the school environment must be child friendly. That is, it must be healthy, safe, secure, and welcoming to the children. Fresh uses 4 strategies in the school health program, and the strategies are as follows. There's effective health related policies. There is practical life skill based health education. There is multi-sectoral linkage between school and other sector. And finally, there is integrating health components in other subjects. We're going to discuss this one after the other. Number 1, effective health-related school policies. First of all, what is a policy? A policy is an officially agreed method of carrying out action in a system or organization. Every school develops health policies, which is how health should be undertaken in the school. For the policies to be effective, teachers, students, parents, and the school authority should all be involved. The content of the health-related policies should ensure a safe and secure school physical environment. It should also address the abuse of students in all forms, be it sexual abuse, physical abuse, emotional abuse, etc. The policies should guarantee furthering of education of pregnant schoolgirls and young mothers. It should reinforce the importance of teachers as role model for their students in terms of dressing, behavior, and hard work. And finally, they should also ensure effective referral to external health service providers anytime the need arises. Now, point number 2, practical life skill based health education. Practical life skill based health education is the education that helps students to develop knowledge, attitudes, values, and especially life skills that are needed to make and take appropriate positive health decisions. In the school and communities, there are some health threats or risks which affect the children's education. These include the likes of sexually transmitted infection such as HIV/AIDS, early pregnancies, substance abuse, violence, etc. These health risks they must be avoided if the students are to progress in the society. And as such, there are skills that are needed to help the students to overcome this. And these skills involve knowing how to deal with peer group pressures, knowing how to negotiate safer sex, etc. Now, students who have these skills are able to cope with and manage their lives in a healthy and productive manner in the school and in the community. Point number 3, multi-sectoral linkage between school and other sectors. Multi-sectoral linkage between school and other sectors. Now, this one refers to effective partnership between the school authority, teachers in the school, and workers in health and education sector. For the school health program to succeed, the school has to partner with the Ministry of Education in the area of teaching and learning, and the Ministry of Health in the area of improved health of the students and workers. For partnership with the Ministry of Education, the Ministry of Education have the following responsibility. First, they have to provide the school with the content to be taught. They need to fund school-based programs, inspect schools for teaching and learning outcomes, provide seminars for teachers and support staffs, ascertain proper layout of learning facilities. And the Ministry of Health is responsible for inspecting the school for proper sanitary conditions, provide vaccination and immunization for children and workers, provide health seminars for teachers and the workers, and also to assess health status of students and workers. Now, other areas of partnership in the school and the community can include the likes of awareness program, parental support programs, and the likes. Point number 4, integrating health components in other subjects. Integrating health components in other subjects. Another way Fresh is able to bring information, knowledge, values, and change to the lives of students is to include health matters in various related subjects to be taught in the school. That is, aside health education, they can also be taught in other subjects. This means that each related subject will carry a relevant health topic which students are taught by the specialist or non-specialist teachers. Subjects that can include this include the likes of social studies, integrated science, physical education, agricultural science, health science, biology, English language, home economics, religious or moral studies, etc. Now, when designing the curriculum, syllabus, and scheme of work for this subject, topics on health problems, especially those of serious national interest or challenges, are included. Things that bother the country, areas educationists actually want the students to focus on health-related issues, they are added to the scheme or curriculum of this particular subject. For example, hunger, malnutrition, micronutrient deficiency, parasite infections, drug and alcohol abuse, premarital sex, HIV/AIDS, and sexually transmitted infection. All these approach enable the teachers of various subjects to emphasize the need to prevent these problems that are associated with health issues. And the students, they are also taught how these problems can affect learning and their overall education. Okay, lovely students, once again we have come to the end of this wonderful lesson. Endeavor to proceed to the quiz section and answer the question that follow. And if there is need for you to view this lesson for proper understanding, endeavor to do so. Bye bye.